Hello, you are listening to the Natural Healing Show for UK Health Radio. I'm your host, Catherine Carrigan, medical intuitive healer, Amazon #1 best-selling author. You can find out more about me and my work at catherinecarrigan.com and unlimitedenergynow.com. While you're there, definitely sign up for my newsletter so you can learn even more about how you can heal yourself naturally. Now, we have a very special guest today. Our guest today is Representative Adam Smith. Representative Adam Smith is a U.S. Congressman and the author of the new book, Lost and Broken: My Journey Back from Chronic Pain and Crippling Anxiety. Representative Adam Smith is the member of Congress who represents the 9th District of the state of Washington. He was reelected to his 14th term in 2022 and has been the top Democrat on the House Armed Services Committee since 2011. When he started in public service at age 25, when he became the youngest person ever elected to the state House of Representatives in his state of Washington. He served as chair of the committee from 2018 to 2022 when the Democrats controlled the majority in the U.S. House. Welcome, Adam Smith.
Well, thank you very much. I appreciate the chance to be on. Look forward to the conversation.
So, Representative Adam Smith, will you share for our audience your website so people can find out more about you and your wonderful work?
The website, the only website I have is basically for my official office, which is adamsmith@mail.house.gov. That's my official website for Congress.
Awesome. Now, we are interviewing you today about your wonderful book, Lost and Broken. Can you tell us more about your book?
Sure. Yeah, no, it's something that I went through. I mean, you listed my biography a little bit. Just to be clear, I was the youngest state senator in the country at the time, not the youngest ever elected, but in the state Senate. So, but I developed over the course of my life a couple of different problems. One, I had a really bad anxiety problem, and I developed chronic pain primarily as a result of knee surgery I had when I was a kid that I didn't properly rehab, and I had bad hips. But gosh, I'd been in Congress for about 12, 14 years when the anxiety just became overwhelming. And then the chronic pain became overwhelming. And I had 3 hip surgeries. I have 2 artificial hips. And I went through a period from 2013 to 2019 when I was in really bad shape. As I outlined in the book, at the lowest point in 2016, I doubted every day whether or not I could get out of bed, both mentally and physically. And it sort of chronicles my journey to figure out, okay, what's wrong with me and how do I fix it? And a lot of that goes back into my history, my childhood, the things that caused the anxiety, the things that caused the pain. And then what I most want to focus on is, how did I find help? Because I went through a lot of different providers, over 100 actually, of one kind or another, before I actually found the people who helped me get better. My dominant message is help exists. If you have a mental health condition like anxiety or depression or chronic pain, there are people out there that can help you. It's a challenging journey to find it, but it's important. And to the point of your show, I like the natural healing approach because I tried the drug approach with antidepressants and anti-anxiety medication and pain medication, dozen different. The natural way is better, probably 90 to 95% of the time.
I love that. So we're
Yes.
in agreement. Now, I myself am the author of 2 books about how to heal depression naturally without drugs, and another book about how to get out of pain naturally. Now, what's special about you, Representative Adam Smith, is that you are a congressman. And for our audience, I want to share some current statistics to help put Representative Smith's journey in perspective. So in 2020, which was, as we recall, the beginning of the pandemic, 20% of American adults receive some form of mental health treatment. And during the pandemic, 1 in 5 Americans were on prescription medications for mental health. In any given year, 1 out of 4 will have some form of diagnosable mental illness. And this doesn't just affect our mental health, it also affects and drives visits to primary care doctors. There's 60 million visits to primary care doctors, primarily driven by mental health issues, and 6 million emergency room visits annually. And then when we put into the extreme challenges of mental health in the United States, in 2021, the latest year for which statistics are currently available, suicide was among the 9 leading causes of death for Americans ages 10 to 64. And among Americans ages 10 to 14 and 20 to 34, suicide was the 2nd leading cause of death. So we're talking about mental health issues that are affecting a very large swath of the American population. Now, why did you write the book Lost and Broken?
Well, and first of all, let me just agree. We have a major behavioral health crisis in this country. And one of my greatest frustrations with it is that, we don't take the right approach to helping people deal with it. Too much drugs, too much confusion about what the right approach is, not an approach to looking at best practices, all kinds of things we can do better. I mean, I wrote the book initially because this is as I was coming out of that very dark period in my life and I was getting better. And, I serve in the Armed Services Committee. I work with the military a lot. It was kind of like an after action report, if you will. Okay, what really happened while it was fresh in my mind? Because I thought it would help me in continuing that healing process. But then as I was writing it, to the point you just made, I realized how many people were in a similar situation. When you think about some combination of anxiety, depression, or chronic pain, I mean, it's 100 million people easily in the US that at some point have experienced that. And I felt that my experience could be helpful as a way to help move forward the conversation, the dialogue, help people talk about it. I've had a number of, people that I work with and friends of mine come up to me and say, reading your book made me realize that I can seek help for what's going on. So that was the main objective, was to better understand my own self, to help with that effort that I'd been going through, and then hopefully to help share it with people so that we could help others who are trying to deal with similar challenges.
What is the main message of your book, Lost and Broken?
Help exists. That's the way I sum it up. Help exists, and it is not just perfectly normal, but it's almost par for the course to go through things like this in your life. Because I think, look, I tell people this all the time when I'm talking about my book. One of my challenges, and I've always been a high stress person. I mean, throughout my life, I've had both some degree of pain and some degree of stress, but it was always manageable. And then when I was 40 years old in 2005, I had this sudden attack of anxiety that was overwhelming. And I didn't know what to do with it. And I dealt with that. And then it came back 7 years later or 8 years later. But during this process, part of my thinking was, I always felt that mental health was a clear line. You were normal or you were crazy. Okay. And I put myself in the normal category. So I didn't have to worry about mental health. All right. And when it came and hit me, it's like I had literally no idea what to do about it. And it took me forever to try to figure that out. And I want to try to, really let people know mental health is as regular as physical health. I mean, from the time you're a kid, you get a well child examination. You go to school and you have to get a physical. You play a sport, you have to get a physical. Everyone says, here's the things you do for your physical health. Well, the same applies to your mental health. You have to think about the way your brain works and how it affects your moods, your emotions, your life. And I really want to get people back on the idea of mental health is something that we need to think about more than we are and deal with more directly than we do as a society.
Now, As you know, we have a national healthcare system. It's different from the healthcare system over in the UK. What are the limitations that you currently see in the US healthcare system? And how can this information help your readers?
Yeah. Well, I mean, there's no perfect healthcare system. And I say this in my book, and I like to point out that I think there's a tendency to look at healthcare and go, gosh, we could just fix this and fix that. I mean, the bottom line is the demand for healthcare services far outweighs the amount of money available to pay for it. I mean, we're all dealing with that situation. When you think about all the healthcare that people would like to have, it's just beyond what any system can afford, and difficult decisions have to be made. I mean, the UK has their public health system. I forget what they call the group that runs it, but and they have to make those decisions too. It's difficult, but I think in the US, a couple of things make it even worse. Number one is the lack of access for so many people. In the UK or Canada, you live in the UK or Canada, you by definition have access to healthcare. Okay. You're part of a system. Now, you don't have access to everything. I think that's a bit of a misunderstanding. But you at least have access. In the US, you can be between healthcare plans. Maybe the provider you want to see doesn't take insurance. It's just this patchwork quilt of trying to figure out how to even get the most basic care available. And then the second thing is we in the US pay for quantity, not quality. The whole system is set up to pay for certain services. And as a consequence, the healthcare providers react to that. You get paid for tests, you get paid for surgeries. You don't get paid as a provider if you see a patient for some length of time. Put differently, you get paid the same amount to see a patient for 30 seconds that you do to see him for 3 hours. So as a consequence, we don't get through problems. We don't really understand what we're dealing with. And this is all really complicated. Whether you're talking mental, physical, you need to have that time for dialogue. And we don't have that in the US because it's all about, making money, turning it over, and quantity, not quality. And I guess the third thing that I would say, we don't, as I alluded to earlier, we don't have a best practices approach. All right. I mean, I've been through enough physical therapists now and also mental health, and I see us every day paying for services that I know are not going to help people. All right. And there's no one to say, look, yeah, this doesn't work. We're not going to pay for that. This does work. This is the direction we're going to go in. So those are the three big problems I see in our healthcare system right now.
So fascinating. Now, here we are at the Natural Healing Show for UK Health Radio. And on this show, we talk about what actually works to heal people naturally. And as I mentioned, I myself have published 2 books about how to heal depression naturally and another book about how to get out of pain naturally. Now, you have your own personal experience. Let's take them. I know that pain and anxiety often go together, but how were you able to overcome chronic pain?
Yeah, the pain, and it's interesting because I went through this really difficult analysis to try to figure out how connected they were. And it's a long story, but I had this knee surgery, bad hip, so I had a bad back, my knee hurt from time to time, from the time I was like 18 years old, and so but it was all manageable. I knew there were certain things I couldn't do with my body, and I was still active and in relatively good shape. I worked out, played basketball occasionally, though my knee sometimes would screw that up. And then the anxiety hit me. The anxiety hit me in 2013, the second time. And that was going on for about a year, and I was on and off medications trying to figure it out when the chronic pain then came in my hips. And so I spent a lot of time thinking about, okay, how are the two connected? 2 quick answers to that. In my case, I had 2 very distinct problems. Certainly they overlapped. The pain made the anxiety worse and vice versa. But I had 2 very distinct problems. Second point, there are times when anxiety can be the cause of your pain. Absolutely. What was not in my case, but it definitely does happen. Now, in terms of the pain, the biggest thing for me was I discovered muscle activation therapy. I went to physical therapists and chiropractors and massage therapists and naturopaths. But what the folks at Muscle Activation Techniques have done is they've figured out how the body and the muscles work. And my problem was my muscles had shut down. All right. you think of muscles as being, you can make them stronger, you can make them lengthen and strengthen. All right. But there's a third important step. They have to be activated. And if you aggravate a muscle, what it'll do is, to protect itself, it will stop firing. Okay. It'll stop, just clenching. All right. And there is a process that these people have come up with to restart the muscle and also get the muscle and the mind, because your nervous system is connected to that muscle, and your brain will tell you, even after you treat the muscle, your brain is going to go, I don't trust that. I know this hurt. This hurt the last time I did it. I'm not doing that. So as they get the muscle restarted, they then have you do the exercise on that particular muscle group to reteach your brain. Nope, it's good. It's okay. We figured it out. It's the way the nervous system works. And again, I'd advise your listeners, Google muscle activation techniques. I don't think they have that in the UK, but it is a new thing that came out of a guy in Denver who I just met with last week, actually. One of his sort of top people is the guy I've been seeing out where I live in Bellevue. But it's really fascinating the way they've figured out how muscles work. And once your muscles work, it's not like I don't have the bad hips and all this other stuff, but now my muscles are working to protect my joints and to protect all the rest of my body. That was the biggest thing that got me over my chronic pain.
The muscle activation therapy. And for our audience, will you share the name of the gentleman in Denver who developed muscle activation therapy?
I'll tell you what, I'll do that in a minute as I'm looking at my calendar and figuring out his last name.
Good. Good.
But what I would tell you, Greg is his name, but that's not going to do you a lot of good. So Google muscle activation techniques. If you go to muscle activation techniques, it will show you what they do. And it'll also show you their practitioners all across the country. And like I said, I don't think that any of them are in the UK, but it's a relatively new thing that they've developed. So that was enormously helpful. But I also had to do the mental side. And the mental side was in some ways even more challenging, just because it's really hard to get through all of the different people out there and find someone who knows how to help you. The guy's name is Greg Roskopf, Roskopf, and Greg with just, two G's, Greg, Roskopf. Great guy. But the mental health journey was really interesting because most of the people I went to initially weren't really explaining to me how anxiety and depression works in a way that I could understand. And it took me until I finally found like my 12th therapist that I'd gone to of psychiatry. He was a psychologist, but I'd been to psychiatrists who really got the things that are necessary to get you back to better mental health.
All right. Now with that, let's take a break and listen to a message from one of our commercial sponsors here at UK Health Radio. You're listening to Catherine Carrigan, medical intuitive healer, Amazon #1 bestselling author, and we're interviewing Representative Adam Smith about his new book, Lost and Broken. Representative Adam Smith. Now, one of my 10 books is called The Difference Between Pain and Suffering. And in that book, I explain what is the difference between pain and suffering. Pain is our physical experience. Suffering is the emotional experience. And in my work, 30 years in natural healing as a medical intuitive healer, part of what I look at is what I refer to as the 5 levels of healing: the physical body, the energy body, the emotions, the mind, and at the soul level. So you mentioned in your experience, working on the mind level was actually the most challenging. What was it that helped you the most overcome your anxiety?
The psychologist who explained to me that there's 3 pieces to it. The one that is fairly widely understood and dealt with a great deal is what loosely can be described as cognitive behavioral therapy. And cognitive behavioral therapy is enormously important, and it's something you really need to practice every day. Basically, what cognitive behavioral therapy tries to get into is you're anxious, you're depressed, you're in this emotional state. You really need to think about it. And so step one is to ask the question, why are you anxious? What's making you anxious? And then you name those things. And a lot of times it will surprise you. You have this feeling, things are going on, but you haven't necessarily made the connection. So thinking about it or sitting down with someone to help guide you through it can really sort of open that door, and you can realize, oh gosh, that's what's making me anxious. And then, once you've named it, then you try to figure out mentally how to deal with it. And there's a couple of things. One, we all have a tendency to catastrophize, a word I had never heard of before I started going to therapy, by the way. But catastrophizing is, okay, the thing you're thinking about, it probably is a problem. Okay, you're not getting along with your boss that well and you're worried about it. But now you've taken this and you've gone, oh my gosh, the guy hates me. I'm going to get fired. I know no way I'm going to find another job. There's nothing else I can do. You blow it way out of proportion and it really starts to get at you. So think about that and think about, well, what's really going on? And then also, as you're walking through these issues, think of things that you can do that could reduce your stress. Okay, you don't know where you stand. Is there someone else in the office that you could talk to who could maybe tell you where it's at? Are you in a situation where you could actually ask for a meeting with the person, with your boss, and sit down and have that conversation? So cognitive behavioral therapy helps you through those things. And one other key piece of it that I don't think we teach people often enough. In fact, I think we're going in the exact wrong direction on that. And that is, how do you react to your emotions? I have a 20-year-old son who I work with on a lot of these issues. And from the time he was like 4 or 5, and I was trying to talk him through things that he was upset about, he would say to me, I can't change the way I feel. And I'd say, yes, you can. Okay, you can really think about it, and you can retrain how your brain reacts to emotional stimuli by thinking about it. Yes, initially you're upset by something that somebody said. Okay, and you could go with that emotion, get really angry about it, or you can go, okay, well, let's just wait a second here. Do I really need to do that? And that's cognitive behavioral therapy, and that's really important, and it's a lifelong thing to try to figure out how you react to things. I've joked with my family, I'm a relatively calm person, except in traffic. Even today, I still, people, and I got to sort of teach myself, it's okay. Just chill, just move forward. So, but the thing that I was missing is there are 2 other cores to mental health. And one of them, and this is what the therapist helped me the most with, the psychologist, was you have to have a sense of your own self-worth. You have to believe that you are, to not sound overly Buddhist about it, that you are worthy of love, okay? And that's what the guy hit me with when I went and saw it. The first thing he ever said to me was, you don't think you have a right to exist, which at the time I thought was insane because, I'm a competitive, passionate guy. At the time, I was successful professionally. I got a great marriage, got great kids. It's like, what do you mean? I believe in myself. But at my core, I really didn't, because I thought that my self-worth was a measurable thing. Okay. Every day, am I doing the right thing? Am I good at my job? Am I doing my job? Am I working hard enough? Am I taking care of my kids right? And I was measuring it every day. All right. And if I didn't measure up, then it was in question. And what he convinced me of, we are all worthy of love. We all have self-worth, not because of anything we do, just because we exist as human beings. And if you don't believe that, and a lot of people don't, because you get that sense of self-worth from bonding experiences as a child, from your earliest days, do you have the basic love that you're supposed to get that gives you that sense of self-worth, or don't you? If you don't have a sense of self-worth, all the cognitive behavioral therapy in the world, forgive me for being blunt here, but cognitive behavioral therapy just pissed me off. Okay, because it was like, yeah, I know all that. I know how to analyze percentages and what is the real risk of this and do all that. And I'm still freaking out, okay? Because you didn't have that basic sense of self-worth. And then the final third piece of this is what psychotherapy does a good job of. And that's to have you deal with the stuff that you're not aware of, okay? To get back into your history. And I love this sentence. It's from a British psychologist whose name is escaping me right at the moment. But anyway, it was the purpose of psychotherapy is not to correct the past. It is to help the patient deal with his history and to grieve for what he has lost. And that was my problem. I was always trying to correct the past. I joked that I was the uncrowned king of regret. I'd always think, I should have done that right. No, you have to understand your history. All right. And it could be something in the moment, could be something that happened when you're 4 years old, could be something that you're upset about because something was done wrong to you, could be something that you did that you never properly apologized for or came to terms with. So that's psychotherapy. Those are the three pieces. You got to have a sense of self-worth, you got to understand your history, and you have to understand cognitive behavioral therapy. And frankly, most of the drugs that we take, they just mask all of that. They bury it. But let me tell you something about the psyche, and you know this better than I do. It's not going to let you bury it. So I just one more quick joke, if I could, before I let you get in there. I remember talking with someone who said that I had suppressed issues way back early on in 2013. And I said, well, I'm 49 years old. If I've been suppressing it for this long, couldn't I just suppress it for another 30 and call it good? No, you can't. It's going to get you if you don't deal with it.
Well, as I'm going to paraphrase Freud, he said, buried emotions never die. They just show up in uglier ways. So,
Amen.
Amen. Buried emotions never die. Now, Representative Adam Smith, it's my experience from 30 years of experience in natural healing that a lot of depression comes from pressure, right? And you, as a member of the U.S. House of Representatives, are in a high pressure job pretty much all the time. How does pressure contribute to anxiety and depression, in your opinion?
Yeah, it's interesting. I think it certainly does, though. I think the most important point, again, the same psychologist that I was talking with about suppressed emotions told me something early on when I didn't understand it. She said, it's not the amount of stress in your life, it's how you process it. And I thought that was crazy because I was building my life around the idea that I've got, here's what I can handle. Okay. And I got to figure out how to make sure I don't go above that. And there is truth to that. There is. I mean, if you take on too much, no matter how well you process stress, it will potentially push you over the line. You do have to come to understand what you yourself can handle and what you can't. But also, if you have that sense of self-love, if you have that understanding of who you are, you will be able to process more. Okay. And that's the biggest thing, is how you react to the stresses in your life. In the modern world, you're just not going to be able to build a life where there isn't some kind of stress coming into it from one direction or another. So, but I'll tell you one thing that I have done in terms of dealing with the stress is I understand, which I didn't before, it is not my responsibility to solve every problem in the world. Right. And I'm not going to do it. And this is how I got to the point where I sleep just fine. As a member of the Armed Services Committee, people frequently ask me the question, what keeps you up at night? And what they're asking about is, you're worried about Iran, Russia, nuclear war. What's the real problem out there? And I would say nothing keeps me up at night, because that doesn't do any good. All right. The problems are going to be there in the morning. I used to literally think that I got to think through this and resolve it. And once I've resolved it, then I can relax. No, you're not going to resolve everything. You go to bed, get up the next morning, the problems will be there, and deal with them then. So that's part of how you then better process the stress, is not to think that you have to solve every single problem.
Great insights. And with that, let's take another break and listen to a message from one of our commercial sponsors here at UK Health Radio. I'm your host, Catherine Carrigan, medical intuitive healer. We're interviewing Representative Adam Smith about his wonderful new book, Lost and Broken. Representative Adam Smith, here we are at the Natural Healing Show for UK Health Radio, and you shared with our audience about muscle activation therapy techniques and also cognitive behavioral therapy. So many of our listeners are engaging in practices that are absolutely not covered by traditional health insurance, such as yoga, such as meditation, such as breathing exercises, such as flower essences, such as acupuncture, acupressure, massage therapy, and I could go on. Have you, in addition to muscle activation therapy and cognitive behavioral therapy, have you integrated any other natural healing approaches into your life to maintain your health and well-being?
Meditation is part of it. Now, I've taken a smaller approach to meditation. I went through a real long struggle trying to figure out what meditation meant and how it worked. I tried a whole bunch of different methods. And I used to joke it to, I'm stressed because I haven't been able to find enough time to meditate. I used to think of meditation as one more thing to be accomplished. I'm sort of that, problem solving, list making, sort of person. And that's not what meditation is. What meditation helps you, and I finally found someone who explained this to me, is it's not you're shutting off your mind, just going, I mean, there are some people who can do that, and that's great. And if you want to do that, that's fine. But mostly what it's teaching you, again, is not to react to everything that comes. The phrase that helped me the most is, it's not that you're clearing all of the thoughts out of your head. It's that you're not chasing them. What you need to do is notice the thought and move on. That's it. So I will do that. I don't know. 2 or 3 times a day. If I'm on a walk, I'll just spend 5 minutes. I'm not going to think. I'm just going to notice the thoughts in the shower, brushing my teeth, whatever. Now, there are some other, if folks want to sit down and do the 20 minutes twice a day, a bunch of different ways to do meditation. But the biggest thing you're training your brain to do is to not chase after everything it experiences.
Great explanation. I love that. Now, as you know, and as you said, you are a big believer in supporting evidence-based medical practices. So when you look at, as a member of the US Congress, what actually works in helping people overcome chronic pain and anxiety, what do you see actually helps and works?
Well, as I said, I think cognitive behavioral therapy does make a big difference. It does. The second thing, as I mentioned, and one more layer on the psychotherapy thing, and we've been doing this a lot with service members who have experienced PTSD, you have to get your brain to look at the traumatic events in its life in a way that is more acceptable to it. Now, there's a lot of focus right now on psychedelics and how they can help with that. Mushrooms, I forget the name of the other thing.
Plant medicine. Plant medicine.
Yeah. And that's, okay. I mean, I could see it working, but it's also really risky because you have to be very careful about how those drugs are interacting in your brain. On the other hand, there are therapies. EMDR is one that I remember the initials too. There's another one that basically no drugs involved. It's not really hypnosis, but it's a way of talking somebody through it. So you literally rewire the brain and how it looks at that specific traumatic experience. And that is really a useful thing that we need to spread more. But the other thing is just within the psychiatric profession and psychologists, I mean, I hate to say it this way, there's a lot of money to be made in not helping people. All right. I mean, if someone wants to come in and pay you $250 an hour once a week for forever, just to come in and talk to you for a while, and you throw a few things at them and they come back the next week, you make a lot of money doing that, but you're not really helping anybody. But who's in there to say, yeah, you shouldn't be doing it that way. You should be doing it this way to give patients a better option. One of the other reasons that I wasn't excited about seeking psychiatric help in the first place was a headline that I read in the satirical magazine, The Onion. And the headline was, "Psychiatrist actually cures somebody." So I just think we need to institute those ideas more widely within the psychiatric and mental therapist professions.
Now, you serve as the top Democrat on the House Armed Services Committee, and you have since 2011. How important is providing access to mental health treatment for the members of our armed services and our veterans?
It's unbelievably important. The biggest reason is just you see the number of suicides within active duty and retired military, and just the mental health challenges that so many have experienced. But then also, just from a practical, what we refer to as readiness in the military world, to make sure that the service members who are in there are prepared to do their jobs. That mental stress and strain is an important part about what can frequently take people out of being ready to perform the tasks that they're trained to do. It's incredibly important. And one of the big challenges there is within the military, there's that sort of can-do attitude. No one wants to admit they have a problem. Look, I've worked with the military. Their ability to overcome obstacles and do what seems like it's impossible is amazing. But you also need to be able to step back and say, no, I need help. And folks in the military aren't. So it's really important that we break through those barriers in order to help people who are dealing with some very, very difficult mental health challenges.
So, and possibly even greater than in the rest of the population, correct?
Absolutely. Absolutely.
So what is being done to provide enough mental health services to our members of our armed forces and our veterans?
Yeah, not enough. We're taking steps. We're trying to move forward with it. And I will say this, in a lot of the bases, a lot of the units out there, there's a much higher priority on mental health than there was even 5 years ago, certainly than 10 or 20 years ago, as we've seen the experiences with the wars in Iraq and Afghanistan, and how they're dealing with it. But a lot more needs to be done. And I would say in particular for our veterans.
So what has brought about this change in attitude where there's a greater recognition of the importance of providing mental health services?
Iraq and Afghanistan, having so many people come back from those experiences and the challenges that they're dealing with. And I think there's also just a broader understanding, and I'm not familiar exactly with how the public in the UK would approach this, but in the US, and just in the last 5 years, there have been a lot more people being public about their mental health challenges, because I didn't mention this part directly when you asked earlier about why I wrote the book, but trying to eliminate the stigma surrounding mental illness is part of it as well. Because I certainly felt this, in 2005 and then again in 2013, one of my big missions was to make sure that nobody knew I was dealing with this. Because I felt if people knew that a member of Congress was doing this, would I even be able to keep my job? All right. But you've seen recently a lot of high profile public figures are talking more openly about the mental health challenges that they are facing. Now, another big part of the message for me is, and I think in our younger generations, there is a more willingness to talk openly about mental health. I always try to emphasize, let's not just talk about it. Let's do something to help people get better. Because it takes on a certain voyeuristic aspect where people, want to write the story about, oh my gosh, look at how crazy I was. And yeah, okay. But the important part to me is, and here's what I did to get better. Here's how I learned how my brain works, how my body works. And now I'm a happier, healthier, more productive human being because I found a path forward.
So my book, the updated book is Banish the Blues Now. And in that book, I share everything that I've learned in 30 years of experience in natural healing about how to heal depression naturally without drugs. Now, you mentioned that in your professional opinion and in your personal opinion, the drug route doesn't necessarily help or overcome depression and anxiety. Why do you feel that way?
A personal experience is the big one. I took clonazepam for a very long period, on and off. I was on a couple different times, and then I tried a SSRI. I tried Celexa, and they really didn't help. And then as I sort of dove into, okay, well, what are these drugs actually doing to your brain? What are they trying to do? It's not surprising to me that it didn't help. It's kind of like a shot in the dark. They're trying to rewire your serotonin and all this other stuff, but they don't have any sort of precision as to how they're doing it. And of course, clonazepam, benzodiazepines, they're horribly addictive, number one, and they definitely have side effects. And more than anything, they bury and mask the issues that you need to deal with. So if you're taking those drugs and trying to get therapy, it's kind of counterproductive because the therapist is trying to get into things that the drug is masking, and just creates all kinds of problems. And the other thing, you can much more effectively naturally rewire your brain with greater precision and less risk through things like psychotherapy and EMDR and talk therapy. And that's, something that I don't think people have a full appreciation for. And the way I try to explain it is physically. Let's say that you wanted to increase your cardiovascular ability. You're out walking, you go up a hill and you're huffing and puffing and you're like, gosh, I want to be able to walk. Well, you go, you start doing a regular exercise routine. You lift weights, you swim, you run, whatever it is. And then bam, all of a sudden, your lung capacity goes up, your muscles get stronger, you're able to do all these things. Your brain works the same way. Okay. If you exercise your brain to better deal with the emotions that are coming at it, then your brain too can become stronger and better able to deal with those challenges that it faces. It's more complicated because the brain is the most complicated, part of our body without question. It's a lot simpler to go, okay, I'm going to go do some curls and my biceps going to be great. But the advancements, and again, you will know this better than I, but the scientific studies as to how the brain works, Paul Allen's foundation has made a massive investment up in the part of the world that I live in, up in the Seattle, Bellevue area, has really discovered, one of the big things is just in terms of brain development, in utero to the age 3, if you just communicate with your child, give them that human interaction, the brain it starts firing and starts working better. So there are all manner of things we can do to make the brain work better. And if you're throwing drugs in there, just one last thing that drives home the point on SSRIs. So I had anxiety, and an SSRI, I thought of as being an antidepressant, and the doctor was prescribing it to me. And I said, look, I don't get this. Depression is one thing, anxiety is the other thing. Depression is trying to ramp you up. I need to be ramped down. And he's like, well, it works both ways. It just takes a little while. Antidepressants can be initially activating for anxiety patients. And they were. Really freaked me out there for a while. But then I was trying to understand, well, how does this work? Well, it's your serotonin level. And one person explained it to me. They said, well, it's kind of like if you're trying to fill up the gas tank in your car by running by it and throwing a bucket of gasoline at it. Okay. And some of it will go in, some of it won't. Eventually I'm like, and you're doing that with my brain? Okay. I'm like, yeah. So yeah, I think the drugs are very, very dangerous. And as you know, there are natural ways to get to the same place with vastly less risk and side effects.
So Representative Adam Smith, author of Lost and Broken, if someone was listening to this broadcast and they are suffering from chronic pain, anxiety, and depression, what advice would you give that individual?
Number one, understand that you can get better, that there are places to go. Because I remember lying in bed, 2016, 51 years old, horribly atrophied, in pain, on medications. And I was thinking, there's no path back from this. And I'm 51, for heaven's sakes. How am I ever going to get past this? I did. So, don't lose hope, number one. Number two, when it comes to muscles, I can't emphasize enough muscle activation. And there are other people who do muscle activation. And in my humble opinion, nobody does it as well as the muscle activation techniques, folks. But that can make a huge difference. And number two, you really do need to think about cognitive behavioral therapy. How does my mind work? And something I should have said earlier when you were asking about access to the healthcare system. It is tough. It's going to be tough in any system. All right. So there's a lot of stuff available online. There's a lot of information out there. Other people who have gone through it. There's a bunch of, you have to take individual responsibility for your own healthcare. Another thing I struggled with, because I don't know any stuff about this. When things started going wrong with me, I wanted to go see a doctor and have that doctor tell me, do this and you'll be fine. That's what I wanted. Okay. I want to think, doesn't work that way. You have to engage, invest in, how do I figure out how to treat myself better? Because a lot of the things in cognitive behavioral therapy, and even to some degree in psychotherapy, it's about conversations. It's stuff that you can help yourself. And if nothing else, when you do see a provider, it will put you in a better position to understand what that person is saying to you. When I first walked in to see the psychologists and psychiatrists I was seeing, I didn't have any idea what they were talking about, and I didn't trust it. So I guess that's the big thing is, and believe me, online research can be a deadly, deadly thing to do, but be discerning about it. There are books, out there like yours and others that can help give you a frame for what you're dealing with, and you need that frame to then be able to get more professional help if necessary.
Now, I have to ask also, so I really appreciate that you are not in favor of medicating anxiety and depression, that you find that can actually be counterproductive. Some researchers believe that there's an increase in mass murders in this country as a result of people being heavily medicated on psychiatric medication. What is your opinion as a member of the U.S. Congress?
Well, I'd have to be careful about giving a specific opinion about that. I will give you this opinion, and that is, people talk a lot about the level of conflict in America today, whether you're talking about mass shootings, people unable to get along in school board meetings. I'm fairly well convinced that undiagnosed mental health problems are a huge part of it. And yes, throwing these medications around, because the other thing about it is medications may work for some people and not work for others. We know that every individual reacts differently to every medication, but we don't know how exactly. So again, you're just throwing this stuff out there and hoping for the best. So yeah, I can absolutely see that medication could definitely it could exacerbate the problem, because you're not really getting at the core of what's driving the brain in that direction. And we have a huge drug problem in this country. As you know, methamphetamines, certainly fentanyl, opiates now are huge. And, so we're trying to deal with behavioral health issues and drug abuse. And the first thing is, no, here, take this drug instead. I'm like, and this drug is different how? I mean, on ADHD and type 2 bipolar, the drug that they're giving you is something that's kind of close to meth. All right. It's just in a slightly different form. Yeah. And I think we ought to think about that more and also be perfectly honest with ourselves. The pharmaceutical industry makes an enormous amount of money off of this stuff. All right. And that drives a lot of the decision making. And you cannot be making these crucial healthcare decisions based on making sure the stock price goes up another 10% next month. Now, one caveat, I never run out of time. As I always like to joke at this point, I'm not going all Tom Cruise on you here. There may be some people out there who benefit from this. There may be. All right. And I don't want to say under no circumstances should anybody ever take medication. All right. But I'll say this, and I will 100% stand by this. We way crazy overprescribe mental health drugs in this country to the point that we're making the problem worse, not better. And that is a statement I am quite confident in making.
So Representative Adam Smith, we at the Natural Healing Show for UK Health Radio very much appreciate your courage in publishing Lost and Broken, and also speaking out about your own personal experience and about what works, and that psychiatric drugs often contribute more to the problem. You've been listening to Catherine Carrigan, medical intuitive healer, Amazon #1 bestselling author. You can find out more about me and my work at CatherineCarrigan.com and UnlimitedEnergyNow.com. Representative Adam Smith, will you share for our audience your website again so people can find out more about you and your wonderful work?
Certainly, Adam Smith at mail.house.gov. And in terms of the book I don't advertise complicated ethics reasons why I can't do that, but I'm on Amazon basically. So Lost and Broken, my journey back from chronic pain and crippling anxiety. That's the place to find the book. And the book also has references in it to psychologists and different sources where you can get help, and to my fine muscle activation therapy folks. So I would urge you to follow that as well.
You've been listening to the Natural Healing Show for UK Health Radio. I'm your host, Catherine Carrigan. And remember, if you are suffering from chronic pain, anxiety, and depression, you can get better naturally. Thank you so much for listening, and we'll see you next time.